Hello, I'm Dr. Ziv Cohen, the Medical Director at Principium Psychiatry, and I'd like to talk with you about cognitive behavioral therapy. CBT was developed in the 1960s by a psychiatrist named Aaron Beck. And Aaron Beck was trained in the psychoanalytic school of psychotherapy, which involves listening to patients share their inner lives and trying to provide them with insights that penetrate to their unconscious wishes and desires and conflicts to help them better understand themselves. Psychoanalysis is a fascinating form of treatment, but Aaron Beck over time became frustrated with psychoanalysis for particular kinds of patients, and especially for depressed and anxious patients. And he developed a modified version of psychoanalysis, which today we call cognitive behavioral therapy. And the focus of CBT is really to be razor focused on the thoughts that the patient is having and which are troubling the patient. And the theory behind CBT is that the thoughts in turn lead to certain emotional states. And the best way to change the emotional states is to examine the thoughts under the light of day and to correct them and modify them, because CBT says that a lot of the thoughts that trouble us and that lead to unhealthy emotional states are actually unrealistic thoughts, distorted thoughts, and therefore if we modify them and make them more realistic, actually the person will feel better. So there are different kinds of distorted cognitions that can occur in CBT. I'll give you one example, and that is catastrophizing. So a patient who is very anxious may frequently think that a small problem will lead to a disaster. For example, I might be late to the doctor, and if I'm late to the doctor, then the doctor won't see me, and if the doctor won't see me, then I'll get sick, and if I get sick, then I'll lose my job, and so on and so on. That's an example of catastrophizing. And so those thoughts, those catastrophizing thoughts, are often implicit in the patient, but they're not fully aware that they're having them. So the therapist will encourage the patient to express those thoughts, go down that sequence of thoughts, and then help the patient reevaluate them and decide whether they're really realistic or not. And for example, in this case, the patient would replace those thoughts with, I might be late to the doctor, but usually the doctor will see me even when I'm late based on my past experience. And if not, I can always reschedule. And I'm unlikely to get sick just from missing one doctor's appointment. So that might seem like a simple example, but there are these kinds of dysfunctional thoughts can really dominate our mental lives and cause us a lot of stress, worry, and depression. And that's the focus of cognitive behavioral therapy. It's a collaborative treatment. It's a short-term treatment usually. Typically, it's about 16 weeks long. And here at Principium Psychiatry, we do offer cognitive behavioral therapy. We have psychiatrists, psychiatric nurse practitioners, and psychologists on staff, all of whom are versed in CBT and can use that as part of a treatment plan to address depression and anxiety. So feel free to give us a call if you'd like to learn more, and we also have information for you on our website.